Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mr. Hughes. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Hughes. How are you feeling today?
Not great, to be honest. I've been feeling really run down for the past few days, and now I've got this fever and muscle aches that won't go away. I thought it was just a cold, but I'm starting to get really worried.
I'm sorry to hear that. Let's talk through your symptoms. When did all this start, and have you noticed anything else, like headaches, rashes, or any changes in your energy levels?
It started about a week ago. I was feeling fine, and then all of a sudden, I got these flu-like symptoms. At first, I thought it might just be stress, but now it feels worse: fever, headaches, joint pain, and I'm really exhausted all the time. I've also had some stiffness in my neck, and these weird red spots on my arms, but I wasn't sure if that was connected.
I see. Thank you for sharing that. With the combination of your symptoms, especially the fever, muscle aches, headaches, and neck stiffness, it's possible that you may have contracted the West Nile virus. This virus is most commonly spread through the bite of an infected mosquito. Have you been outside a lot lately, especially in areas where mosquitoes are common?
Yeah, actually. I was camping about 2 weeks ago near the lake, and there were tons of mosquitoes around. I didn't think much of it at the time, but I did get bitten quite a few times. Are you saying that those bites could have caused all of this?
It's very possible, especially since West Nile virus is transmitted by mosquitoes. When an infected mosquito bites a person, it can pass the virus into their bloodstream. Most people who get West Nile don't experience any symptoms or only mild ones, but in some cases like yours, the virus can lead to more noticeable flu-like symptoms. The good news is that most people recover fully without any specific treatment, but we'll need to monitor your condition closely, particularly because of the neck stiffness and headaches you mentioned.
I didn't know mosquitoes could cause something like this. How serious is it? Should I be really worried?
In the majority of cases, West Nile virus causes mild symptoms, and people recover on their own within a few weeks. However, in some instances, the virus can affect the central nervous system, leading to more severe conditions like meningitis or encephalitis, which is inflammation of the brain. These more serious forms are rare, but can cause symptoms like severe headaches, high fever, stiff neck, confusion, or muscle weakness. Since you're experiencing neck stiffness and headaches, we need to be cautious and monitor your symptoms closely to ensure they don't worsen.
That sounds pretty scary. Is there any specific test to confirm that it's West Nile virus?
Yes, there are tests we can run to confirm if it's West Nile virus. A blood test is usually the first step, as it can detect antibodies that your immune system produces in response to the virus. In more severe cases, a lumbar puncture, also known as a spinal tap, may be necessary to check for signs of inflammation or infection in the central nervous system. Based on your symptoms, I'll recommend starting with a blood test to get a clearer picture of what's going on.
How long would it take to get the results from the blood test? And in the meantime, is there anything I can do to feel better?
It typically takes a few days to get the results from the blood test, but we'll start managing your symptoms right away. Since there's no specific antiviral treatment for West Nile virus, the focus is on supportive care, meaning we'll help relieve your symptoms while your body fights off the virus. You should rest as much as possible, stay hydrated, and take over-the-counter pain relievers like ibuprofen or acetaminophen to reduce your fever and ease muscle pain. If your symptoms get worse, especially if you develop confusion, severe headaches or weakness, you should seek medical attention immediately.
Okay, I'll make sure to rest up. Is there anything else I should be on the lookout for?
In addition to worsening headaches or confusion, watch out for difficulty moving or any new neurological symptoms, like changes in vision or muscle weakness, as these could indicate a more serious form of the virus affecting your nervous system. If you notice any of those signs, don't wait, seek emergency care right away. But based on your current symptoms, I'm optimistic that with rest and hydration, you should start to feel better soon.
That's a relief to hear. How long do you think it'll take for me to recover fully?
For mild cases of West Nile virus, most people recover within a few weeks, though some symptoms like fatigue or muscle aches can linger for a bit longer. Everyone's recovery is a little different, but I expect you'll start feeling significantly better in about 1 to 2 weeks. I'll schedule a follow-up appointment to check on your progress and make sure the symptoms are improving.
Extract 2, questions 13 to 24. You hear a GP talking with a patient, Mr. Nicholas. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, Mr. Nicholas. It's nice to meet you today. How can I help?
Hi, doctor. Thanks for seeing me. I've been feeling pretty under the weather for a while now, and I wanted to see if you could figure out what's going on.
Of course. I see from your notes that you've been experiencing fatigue, fever, and some respiratory issues for a few weeks. Can you tell me a bit more about how you've been feeling?
Yeah, I've been exhausted. It started with a mild fever and chills, which I thought was just a cold, but it hasn't gone away. I've also been coughing a lot, and my chest feels tight. I thought maybe it was pneumonia, but it's been going on for more than a month now, and I still feel terrible. I also had these weird red bumps on my legs a couple of weeks ago, but they went away.
That does sound frustrating. Are you experiencing any other symptoms, like joint pain or headaches?
Actually, yes. My joints have been sore, especially my knees and ankles, and I've had a couple of bad headaches too. The fatigue is the worst part. I can't seem to shake it, no matter how much I rest.
And have you traveled recently, or spent time in areas where dust or soil might have been kicked up? Any outdoor activities, perhaps?
I haven't traveled far, but I was on a work trip a couple of months ago in Arizona. I was outdoors a lot, and it was pretty dusty. Do you think that has something to do with this?
It might. Given your symptoms and the fact that you were in an area where valley fever, also known as coccidioidomycosis, is more common, we should consider that as a possibility. Valley fever is caused by a fungus that lives in soil in certain regions like Arizona, and when the soil is disturbed, the spores can become airborne and inhaled. Once inhaled, they can cause an infection in the lungs.
Valley fever. I've never heard of that. How serious is it?
It can vary from person to person. Some people might have mild symptoms that go away on their own, much like a common cold or flu. But in other cases, like yours, it can lead to prolonged symptoms such as fever, fatigue, cough, and joint pain. The red bumps you mentioned on your legs are called erythema nodosum, which is a common skin reaction associated with valley fever. Most people recover without treatment, but in some cases, the infection can spread to other parts of the body or linger for a longer period.
That sounds pretty serious. Could this be what's been making me feel so bad for so long?
It's certainly a strong possibility, especially considering your exposure to the dust in Arizona. We'll need to do some tests to confirm it. A blood test can check for antibodies to the fungus, and we may also do a chest X-ray to see if there's any sign of the infection in your lungs.
I see. If it is valley fever, how do you treat it?
In most cases, people with mild symptoms don't need any treatment, and the infection clears up on its own. Rest and hydration are usually enough. However, because your symptoms have persisted for several weeks and are more severe, you may need an antifungal medication to help your body fight off the infection. We'd monitor you closely to see how you respond.
And what happens if I don't treat it?
If left untreated, some cases of valley fever can lead to more serious complications, like the infection spreading to other parts of the body, such as the bones, skin, or brain. This is rare, but it's something we want to avoid. Early treatment can prevent it from becoming more severe.
I definitely don't want that. How long would I need to take the antifungal medication?
It depends on how well you respond to the treatment. Some people may need it for a few months, while others, in more complicated cases, may require it for longer. The important thing is that we track your progress and adjust the treatment plan as needed. If we start you on the medication, we'll also follow up regularly with blood tests to make sure the infection is clearing.
And will I start?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now, look at question 25. You hear a GP talking to a patient. Now read the question.
So, Mr. Adams, from the results we have, it seems there are some unusual findings in your DNA tests.
Oh, really? I didn't realize anything could be wrong with my DNA. I haven't had any major health issues until recently.
Well, what we're seeing is that you have 2 distinct sets of DNA, which is quite rare. This condition is known as chimerism. It's where a person carries 2 sets of DNA, often due to absorbing a twin during early development in the womb.
2 sets of DNA? How is that even possible?
It's unusual, but it can happen. In your case, it may explain some of the inconsistencies in your medical tests, like your blood type not matching some of your tissues. Now, did you have any issues with organ function recently?
Actually, yes, I've been experiencing kidney problems.
That's interesting. Chimerism can sometimes lead to complications in the organs, as the body may react to different DNA in different tissues. I'll need to run further tests to confirm this.
Now look at question 26. You hear a physical therapist discussing with a patient. Now read the question.
Concerns.
Yes, I've been dealing with this back pain for years now. It gets really bad when I sit for long periods, and it's difficult to move around without feeling stiff and sore.
I see. What are the main activities or movements that are most painful for you at the moment?
Standing up from a seated position is the worst. I also struggle to bend down or twist my body without a lot of pain. Sometimes, just getting out of bed can be a real challenge.
What do you feel is your biggest challenge with your back pain right now?
I really want to be able to move more freely without being in constant pain. It's affecting my daily routine, and I'm worried about how much longer I can manage like this.
Now look at question 27. You hear two radiologists discussing the possible diagnosis of a patient. Now read the question.
I have a case of a 65-year-old male with a persistent cough and some weight loss over the past few months. He was referred by his GP after a chest X-ray raised concerns about a possible mass. I ordered a CT scan as the X-ray findings were inconclusive.
Let's take a look at the CT scan. Do you see that? There's a small nodule in the upper lobe of the left lung. It's just over 6 millimeters in size, which could be significant.
That could be the cause of the patient's symptoms. Have you considered the possibility of early-stage lung cancer?
Yes, but it could also be benign. We might need to follow up with further scans to monitor its growth.
Now look at question 28. You hear a conversation about a difficulty coping with father's condition. Now read the question.
Hi, Nurse Smith. I'm feeling a bit overwhelmed. How am I supposed to manage all of this when my father is discharged?
I understand this can be quite challenging. Have you had a conversation with the hospital's discharge coordinator?
Yes, we talked, but I'm really worried about handling everything by myself. The hospital said they could arrange for some help, but I'm unsure what's best. I don't know if I can manage all his needs at home.
Have you asked your father how he feels about going home? His comfort and feelings should really guide the decision.
Now look at question 29. You hear a medical professional explaining revisiting their team huddle process. Now read the question.
This is session number 8, where we're going to revisit our team huddle process. We've already covered how these daily huddles improve communication and align our goals for the day. Last time, we discussed reviewing the patient's schedule and anticipating challenges. Today, we'll expand on that by looking at cross-training within the team, which allows team members to switch roles when necessary. We won't dive into the specifics of every role today, you'll tackle that next month, but we'll focus on how flexible role assignments can help during busy periods or when someone is unavailable. In today's session, we'll also touch on delegating tasks, seamless transitions between team members, and strategies to prevent bottlenecks.
Now look at question 30. You hear two doctors talking each other. Now read the question.
Do you have a minute? I'd like to get your thoughts on a patient of mine with asthma.
Of course. What's going on with the patient?
I have a 35-year-old man with moderate persistent asthma. He's been on an inhaled corticosteroid and a long-acting beta agonist for over a year. He had a recent flare-up, and I'm wondering if I should adjust his treatment. His symptoms have been worsening despite adherence to his medication plan, and his peak flow readings have been declining. I'm considering stepping up his treatment, but I'm not sure how aggressively I should proceed.
Well, current guidelines suggest that in cases of worsening asthma symptoms, it's reasonable to either increase the dosage of his inhaled corticosteroids or consider adding a leukotriene modifier. Since his symptoms seem persistent, I'd recommend increasing the inhaled corticosteroid dose first and monitoring his response. If his symptoms continue to worsen, you might consider adding a leukotriene modifier as a next step.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a radiologist in personalized medicine giving a detailed presentation on radiologists in personalized medicine. You now have 90 seconds to read questions.
Hello everyone. I'm Dr. Sharon Lawson, and I appreciate you joining me today as we explore the evolving role of radiologists in personalized medicine. While technology has significantly impacted medical imaging, our discussion today will go beyond the advances in diagnostics. We'll focus on how these technological shifts are helping radiologists play a more active role in delivering patient-centered, individualized healthcare. Personalized medicine is transforming healthcare by focusing on tailoring treatment approaches to fit each patient's unique needs and characteristics. In this context, radiologists are becoming essential in applying personalized medical techniques. One major trend shaping this transformation is the use of imaging biomarkers. Imaging biomarkers are observable signals in medical images that provide critical information about a patient's health, assisting in diagnosis and treatment decisions. Radiologists use these biomarkers to collaborate closely with oncologists in choosing the most appropriate therapies for cancer patients. This collaboration helps ensure that each patient gets treatment designed specifically for their condition, with an approach that maximizes effectiveness. The use of imaging biomarkers is particularly impactful in cancer care. Advanced imaging technologies, such as PET scans and MRI, help track changes in tumors, allowing doctors to observe how well a treatment is working and determine if adjustments are needed. In this capacity, radiologists provide invaluable data that assists the care team in real-time decision-making, ensuring that treatment is dynamically adjusted to the patient's evolving needs. The second trend I want to explore is radiogenomics, a rapidly growing field that connects radiographic imaging with genetic and molecular information. Radiogenomics is important because it allows us to infer genetic mutations within tumors without needing a physical biopsy, thus reducing patient discomfort and risks. By integrating imaging results with genetic data, we can better understand tumor biology and provide personalized treatment recommendations that align with each patient's genetic profile. This non-invasive way of gathering molecular-level information is a major leap in personalized healthcare, and radiologists are at the core of this innovation. Equally important is the evolving role of radiologists as clinical collaborators. Traditionally, radiologists worked behind the scenes, interpreting scans and relaying information to other physicians. However, personalized medicine increasingly demands a more integrative approach. Radiologists are becoming active participants in multidisciplinary care teams, such as those assembled in tumor board meetings. During these discussions, radiologists present imaging findings directly to oncologists, surgeons, and other specialists. These collaborative interactions enable radiologists to contribute meaningfully to the care plan, shaping a patient's treatment journey based on imaging data and clinical insight. This enhanced role is largely possible due to technological advancements. Artificial intelligence, in particular, has changed our workflow by taking on many repetitive tasks that once consumed our time. Machine learning algorithms can perform preliminary image analysis, highlight potential abnormalities, and flag areas for closer inspection. By leveraging AI tools, radiologists can focus on more intricate and challenging aspects of imaging, as well as spend more time directly engaging with patients and other healthcare providers. This is crucial in the era of personalized medicine, where patients want more information and reassurance about their conditions. Another vital element of personalized medicine is communication with patients. Historically, radiologists had limited direct contact with patients, often working in the background. Now, however, we frequently engage with patients, explaining imaging findings and collaborating in decision-making. Sitting down with a patient to discuss their scans helps demystify the imaging process, providing clarity and comfort that can alleviate anxiety and empower patients. This shift means that radiologists must not only be experts in imaging interpretation but also effective communicators who can convey complex medical information in an accessible way. However, this transition does not come without its challenges. One of the primary obstacles in adopting personalized medicine is the need for specialized training for radiologists. It's no longer enough for radiologists to be adept at reading scans. We need to understand genetics, appreciate the nuances of targeted therapies, and become proficient at patient interaction. To address these needs, radiology residency and fellowship programs are evolving, though there is still much work to be done to ensure that future radiologists are fully prepared for these expanded responsibilities. Another challenge is time management. Personalized care requires greater involvement, and radiologists need to balance their diagnostic responsibilities with patient consultations and team collaborations. Traditional workflows were not designed for these additional duties, so radiologists must reimagine how to effectively manage their time to provide high-quality imaging analysis alongside enhanced patient interactions. These changes are crucial, but they will ultimately lead to better outcomes for patients. In conclusion, the role of radiologists is evolving rapidly as personalized medicine becomes the norm. We are moving beyond simply diagnosing diseases and instead contributing directly to the treatment planning and individualized care for patients. The integration of imaging biomarkers and radiogenomics is providing us with tools to make better, personalized treatment decisions. While technology like AI has freed up time for us to play a more active role in clinical settings, additionally, our increasing involvement in direct patient consultations helps patients understand their care options better and feel empowered in their healthcare journey. Despite the challenges that come with these shifts, such as the need for specialized training and adapting workflows, the future of radiology is exciting, with radiologists playing an essential role in the journey toward truly individualized patient care.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Lewis Carter about joint replacement. Now, read the questions. You now have 90 seconds to read questions.
joint replacement surgery has become increasingly common as a treatment for severe arthritis and other joint-related issues. However, the success of the surgery often depends on how well patients follow the rehabilitation process afterward. Today we're speaking with Dr. Lewis Carter, an orthopedic specialist who has led a study on post-surgery rehabilitation techniques. Lewis, could you start by explaining why rehabilitation is so important after joint replacement surgery?
Of course. Rehabilitation plays a vital role in helping patients regain full function of the replaced joint. Without proper physical therapy, the muscles surrounding the joint can weaken, and scar tissue can form, which limits mobility. The aim of rehabilitation is to restore strength and flexibility, and to ensure that the joint heals correctly, which ultimately improves the long-term outcome of the surgery. In fact, we often say that the surgery is only half the battle. The other half is how committed the patient is to their recovery process.
That makes sense. So, what does the typical rehabilitation process look like for someone who has had a joint replacement?
The rehabilitation process typically starts within 24 to 48 hours after surgery. Patients are encouraged to begin moving the joint under supervision as soon as possible. This early movement is crucial for preventing stiffness and promoting circulation, which aids healing. A physiotherapist will usually guide the patient through specific exercises aimed at increasing the range of motion and strengthening the muscles around the joint. We usually divide the process into 3 phases. The first phase focuses on gentle, assisted movements to ensure the joint stays mobile without putting too much pressure on it. In the second phase, we gradually introduce weight-bearing exercises, which help to strengthen the joint and surrounding muscles. The third phase focuses on returning the patient to their normal activities. This final phase can take several months depending on the patient's progress.
What role does the patient play in ensuring a successful recovery?
Patient commitment is absolutely crucial. They need to follow the prescribed exercise regimen consistently, even after they leave the hospital or rehab center. I always tell my patients that recovery is a partnership. The surgeon can perform a perfect surgery, but if the patient doesn't put in the work during rehabilitation, they won't achieve the best possible outcome. Adherence to the exercises is especially important during the early stages of recovery. Neglecting therapy can lead to complications like muscle atrophy or joint instability, both of which can severely limit mobility. Additionally, patients must manage their pain effectively so that they can continue participating in their exercises. This can involve pain medications or alternative therapies, depending on what works best for the individual.
You mentioned complications. Could you explain what might happen if a patient doesn't stick to their rehabilitation plan?
Certainly. One of the most common complications is the formation of scar tissue, which can severely restrict the range of motion in the joint. When patients don't move the joint enough, the body tends to form excess scar tissue, and this can make the joint stiff and difficult to bend. In extreme cases, patients might even need another surgery to remove the scar tissue. Another complication is muscle atrophy. After surgery, the muscles around the joint are weakened, and without proper rehabilitation, they can waste away further. This makes the joint less stable, which can lead to falls or further injuries. Inadequate rehabilitation can also lead to persistent pain, which many patients think is a sign that they should stop exercising. But it's actually a sign that they need to continue under the guidance of their physiotherapist.
That sounds serious. How long should a patient expect to be in rehabilitation after a joint replacement surgery?
The length of rehabilitation depends on the type of joint that was replaced and the individual's overall health. For knee and hip replacements, the average rehabilitation period is about 3 to 6 months. However, it can take up to a year for patients to fully regain their strength and mobility. During this time, it's essential to follow up with healthcare providers and physiotherapists to ensure that the recovery is on track. In some cases, patients may feel like they're fully recovered after a few months, but they shouldn't stop their exercises prematurely. Long-term recovery often involves maintaining a certain level of activity and continuing with less intensive exercises to keep the joint functional and pain-free.
And what about pain management? How does that factor into rehabilitation?
Pain management is a key part of the rehabilitation process. Right after surgery, patients typically experience a fair amount of discomfort, and it's important to manage that pain so they can participate in therapy. This might involve a combination of medications, such as anti-inflammatories or opioids for short-term relief. However, we try to minimize opioid use because of the risk of dependence. Non-pharmaceutical options like ice therapy and elevation can also be quite effective, especially in the early days. In the later stages of rehabilitation, many patients find that the pain subsides as they regain strength and flexibility. The goal is to manage pain well enough so that it doesn't hinder the patient's ability to move and exercise.
Based on your study, what advice would you give to patients who are about to undergo joint replacement surgery?
My biggest piece of advice is to be prepared for the rehabilitation process. Many patients focus on the surgery itself, but they don't always realize how much effort goes into recovery. I encourage patients to set realistic expectations about the length and intensity of rehabilitation. Also, they should communicate openly with their healthcare team about any pain or difficulties they're experiencing, so adjustments can be made to their treatment plan. Lastly, patients should take advantage of the support systems available to them, whether that's family, friends, or professional caregivers. Having someone to help with daily activities during the first few weeks can make a big difference in staying on track with rehabilitation.
That is the end of Part C. You now have 2 minutes to check your answers.